Here are some key considerations for nurse practitioners looking to start their own practice. Understanding the business side of practice ownership. As a nurse practitioner, you have a deep understanding of patient care and clinical expertise. These professionals can provide valuable guidance on establishing a successful practice, navigating regulatory requirements, and managing the business side of things. Preparing for private practice. Understanding the business side of healthcare. As a nurse practitioner, you're likely familiar with the clinical aspects of patient care. However, establishing a successful private practice requires a different set of skills. To get started, it's essential to understand the business side of healthcare. Rural areas, on the other hand, may have fewer patients but lower operational costs and a more relaxed regulatory environment. The benefits of private practice for NPs. A growing trend. The trend of NPs establishing private practices is on the rise. This shift is driven by several factors, including the increasing demand for primary care services, the growing need for specialized care, and the desire for NPs to have more control over their practice. Autonomy and independence. Flexibility in scheduling and patient selection. Potential for higher earnings. Ability to specialize in a particular area of interest. Overcoming challenges. Establishing a private practice as an NP requires careful planning and execution. NPs must navigate a complex regulatory landscape to ensure compliance with federal requirements. NPs must also be aware of the scope of their practice, including the types of patients they can see, the services they can provide, and the settings in which they can practice. Understanding the regulatory landscape for NPs. Federal regulations. Overview of federal requirements. The federal government sets the overall framework for nurse practitioner (NP) practice. Financial planning for NPs. Financial planning is a crucial component of launching and sustaining a private practice as a nurse practitioner (NP). It involves creating a comprehensive business plan that outlines startup costs, revenue projections, and expense management strategies. A well-structured financial plan helps NPs make informed decisions about their practice, ensuring they can meet their financial goals and achieve long-term sustainability. Key components of a financial plan. Startup costs. NPs need to consider the initial investment required to launch their practice, including costs such as *** rent or mortgage for office space, equipment and technology, marketing and advertising expenses, insurance premiums, licenses and certifications, fees. Revenue projections. A financial plan should include projected revenue streams, such as *** patient fees, insurance reimbursement, government funding, partnerships and collaborations. Expense management strategies. NPs should identify and manage expenses, including *** staffing and personnel costs, office expenses, marketing and advertising expenses, insurance premiums, malpractice insurance. Creating a financial plan. To create a comprehensive financial plan, NPs should consider the following steps. Conduct market research. Research the market demand for NP services, competition, and pricing trends. Develop a business model. Define the NP's business model, including the services offered, target market, and revenue streams. Create a budget. Develop a detailed budget that outlines projected income and expenses. Establish financial goals. Set specific financial goals, such as achieving a certain level of revenue or reducing expenses. Navigating the complex world of insurance billing and credentialing for private practice success. Effective management of these revenue streams is crucial for the success of a private practice. Understanding the insurance billing process. Insurance billing is a critical component of a private practice's revenue stream. It involves submitting claims to insurance companies on behalf of patients, ensuring that the practice receives reimbursement for services rendered. However, the process can be complex, with multiple stakeholders and varying reimbursement rates. Key players in the insurance billing process include insurance companies, patients, private practices, billing companies. The process typically involves pre-authorization, claim submission, reimbursement processing, follow-up, and appeals. To navigate this complex process, private practices must develop a thorough understanding of insurance billing and reimbursement rates. This includes researching and selecting the most suitable insurance billing software, ensuring accurate and timely claim submissions, negotiating reimbursement rates with payers, managing and resolving claims disputes, credentialing with payers. Credentialing with payers is Another essential aspect of a private practice's revenue stream. A well-designed website is crucial for creating a positive first impression and showcasing the practice's services and expertise. Creating a strong digital presence is essential for attracting new patients. This includes a professional website that is easy to navigate and provides clear information about the practice's services and expertise. Search engine optimization, SEO, best practices to improve the website's visibility in search engine results. Social media presence to engage with potential patients and build a community around the practice. Online reviews and ratings to build credibility and trust with potential patients. Hashtag building a community around the practice is crucial for attracting new patients. This includes hosting events and workshops to educate patients about the practice's services and expertise. Partnering with local businesses and organizations to build relationships and generate referrals. Engaging with patients on social media to build a community around the practice. Encouraging patient referrals and testimonials to build credibility and trust with potential patients. Harnessing the power of patient advocacy to drive growth and loyalty in medical practices. The power of word-of-mouth marketing. Word-of-mouth marketing is a highly effective and cost-efficient way to attract new patients to a medical practice. When patients have a positive experience with a healthcare provider, they are more likely to recommend that experience to others. This type of marketing is often referred to as patient advocacy or word-of-mouth referrals. Benefits of word-of-mouth marketing encourages patient loyalty and retention, increases patient satisfaction and trust, provides a cost-effective marketing strategy, can lead to increased revenue and growth. The role of staffing in word-of-mouth marketing. Staffing decisions play a crucial role in practice operations. A well-trained and supportive staff can make a significant difference in patient satisfaction and loyalty. When staff members are knowledgeable, empathetic, and responsive to patient needs, they can create a positive experience that encourages patients to recommend the practice to others. Implementing an electronic health record (EHR) system. Implementing an EHR system can streamline workflow and improve efficiency in a medical practice. An EHR system allows healthcare providers to access patient information quickly and easily, reducing the time spent on administrative tasks. Here are some key takeaways for private practice owners. Key challenges in private practice. Financial risks. Private practices are often self-funded, leaving owners with significant financial responsibilities. Regulatory complexities. Private practices must comply with various regulations, including HIPAA, which can be time-consuming and costly. Operational hurdles. Managing staff, equipment, and facilities can be a significant challenge for private practice owners. Managing financial risks. Managing financial risks. Private practice owners must be proactive in managing financial risks. This includes creating a comprehensive business plan that outlines projected income and expenses. Developing a cash flow management strategy to ensure timely payments. Building an emergency fund to cover unexpected expenses. The benefits of NPs. NPs are not just a means to an end, they are a way of life. By becoming an NP, you can create a sustainable and rewarding private practice that brings you fulfillment and financial stability. Financial benefits. Higher earning potential. NPs can charge higher fees for their services, resulting in higher earnings. Increased autonomy. As an NP, you have more control over your practice, allowing you to make decisions that align with your values and goals. Reduced overhead costs. By working independently, you can reduce your overhead costs and allocate more resources to your practice. Personal benefits. Personal benefits. Autonomy and independence. As an NP, you have the freedom to make decisions about your practice, allowing you to work in a way that suits your style and preferences. Personal fulfillment. By creating a practice that aligns with your values and goals, you can experience a sense of purpose and fulfillment.